Good evening. Thanks for joining us. The worldwide resurgence in measles has now reached BC. The first confirmed case in our province is a child new to Canada. This comes as other parts of Canada are seeing infections in people who haven't traveled. Our Penny Daflos now on what you need to know.
The characteristic rash, fever, and cough that come with measles tell only part of the story.
I think we've forgotten what impact measles used to have and how sick people used to get from it beyond just a simple rash. Many people with measles would get significant life-changing problems from it.
Measles is one of the most infectious viruses on the planet. Following several new cases across Canada in recent weeks, BC now has our first imported case since 2019.
It's an unvaccinated child who's new to Canada. May well have come from a country with limited resources for vaccination, so we don't know the specific circumstances, but they're unvaccinated and they became ill after arrival.
Potential exposure sites include the Vancouver Airport Hotel, which is actually on Westminster Highway in Richmond, and Richmond's ICBC office last Monday.
Measles is highly contagious, and there have been case reports of people being infected who were in a room after a measles case left the room.
Children are typically vaccinated at 1 and 5 years old in BC, the two doses providing 99% protection against infection.
There are enough complications and worries that what you want is for your child not to catch measles.
Montreal is the epicenter of measles infection in Canada, where some schools have vaccination rates as low as 40%. 2 of the 4 children who were infected there have been hospitalized.
I'm concerned about every case of measles. In 2019, there were 29 cases of measles in British Columbia, and we took very strong action to address that at that time.
Some 38,000 school-age kids were immunized in BC after that outbreak. There are many options to get your first or second shot, and healthcare professionals are ready to address those with vaccine hesitancy.
Is it because of another vaccine that they had a bad experience with? Is it on the safety of the measles vaccine? Are they worried about the discomfort on the day of? Let's have that conversation.
And Penny Daflos joins us now. So, Penny, what more do we know about this first case in BC?
Well, we know the child is under 10 years old, and the hotel they were staying at with their families has extensive contact tracing from Vancouver Coastal Health, and they're prepared to isolate any secondary cases there. Now, while the risk here is limited, cases are rising around the world, and with spring break around the corner, health officials say now is a good time to consider vaccinating yourself against this life-threatening virus, Mijong.
All right, an important message there. Thank you, Penny.
You bet.